I am Mr. Sandeep Dattatreya Kardili, M.Pharm Pharmaceutics, lecturer, Mula Rural Institute of Pharmacy, Sone. I am giving presentation on Introduction to Different Dosage Forms, Part 4. First of all, contents of my presentation. In this part, we will study semi-solid dosage forms, in that ointment, creams, paste, jellies, suppositories. Semi-solid dosage forms. Semi-solid dosage form mean for external application. They contain one or more active ingredients dissolved or uniformly dispersed in a suitable base and any suitable excipients such as emulsifiers, viscosity increasing agents, antimicrobial agents, antioxidants, or stabilizing agents. Semi-solid dosage form are categorized as ointment, creams, paste, jellies, suppositories. Firstly, we will see ointment. Ointments are homogeneous semi-solid preparation meant for application to skin or mucous membrane. Ointments are mainly used for their protective or emollient properties. In the figure, ointment is shown. They usually contain a medicament or medicaments dissolved, suspended, or emulsified in the ointment base. They may contain a suitable antimicrobial preservative. The ointment are mainly used as a protective or emollient for the skin. The medicated ointments are meant for action on epidermis or for action on deeper layers of cutaneous tissues or to penetrate deep and release medicaments to body fluids. The ointments which are meant for application to the eye are called as ophthalmic ointments. These ointments are sterile and free from irritation. In the preparation of these ointments, the yellow soft paraffin is used instead of white soft paraffin. The reason for this being that white soft paraffin may contain small traces of the bleaching agent which are generally left over after bleaching the yellow soft paraffin. Hence, the white soft paraffin may cause irritation to the eye. While selecting a suitable ointment base, the factors such as the action desired, nature of the medicament to be incorporated, and the stability of an ointment are to be considered. An ideal ointment base should possess the following properties. First, it should be inert, odorless, and smooth. Second, it should be physically and chemically stable. Third, it should be compatible with the skin and with the incorporated medicaments. It should be of such a consistency that it spreads and softens when applied to the skin with stress. It should not retard healing of the wound. It should not produce irritation or sensitization. There is no single ointment base which possesses all the qualities of ideal ointment base. So, it becomes necessary to use more than one base in the preparation of ointments. The ointment bases are into first oleogenous bases, absorption bases, emulsion bases, and fourth water soluble bases. First, oleogenous bases. These bases consist of water soluble hydrocarbons, vegetable oils, animal fats, and waxes. The constituent of hydrocarbon bases are soft paraffin, hard paraffin, and liquid paraffin. The animal fat includes lard. The vegetable oils are used chiefly in ointments to lower the melting point or to soften bases of higher consistency. These bases serve to keep the medicaments in prolonged contact with the skin and also act as occlusive dressings. They have a low capacity to absorb water and are used cheaply for their emollient effects. These bases serve to keep the medicaments in prolonged contact with the skin and also act as occlusive dressings. They have a low capacity to absorb water and are used cheaply for their emollient effects. Bases are losing their importance nowadays for following. First, they are greasy. Second, they are sticky and are difficult to remove both from skin and clothing. Third, they retain body heat, which may produce an uncomfortable feeling of warmth. Fourth, they do not help in absorption of medicaments. Then, absorption bases. These bases are generally anhydrous substances which have the property of absorbing, that is emulsifying, considerable quantities of water but still retaining their ointment like consistency. The absorption bases are of two types: non emulsified bases and water in oil emulsions. The non emulsified bases absorb water and aqueous solutions, producing W/O emulsions, for example, wool fat, that is anhydrous lanolin, then wool alcohol, beeswax, and cholesterol. The water in oil emulsions are capable of absorbing more water and have the properties of non-emulsified bases, for example, hydrous wool fat, that is lanolin. Bases are used as vehicles for aqueous liquids or as solutions of medicaments. Then emulsion bases. These bases are semi-solid or have a cream-like consistency. Both O/W and W/O emulsions are used as an ointment base. The oil in water type of emulsion bases are more popular because they can be easily removed from the skin or clothes by washing with water. The W/O type of bases are greasy and sticky. For example, compound benzoic acid ointment, it is also called as a Whitefield's ointment, and zinc undecinoate ointment are prepared by using the emulsifying ointment. The emulsifying ointment is prepared from emulsifying wax, whites of paraffin and liquid paraffin. Water soluble bases. These are commonly known as greaseless ointment bases. The water soluble bases consist of water soluble ingredients such as polyethylene glycol, polymers which are popularly known as carbowaxes. The carbowaxes are water soluble, non volatile, and inert substances. These are available in varying consistencies depending upon their molecular weights. The polyethylene glycols 400, 1500, 4000, and 6000 are most commonly used in pharmacy. By mixing different carboxylates, ointments of varying consistencies can be obtained. The following are examples of some of the important and commonly used ointments which are official. Emulsifying ointment IP. Emulsifying wax 300 gram artificial. Whites of paraffin 500 gram. Liquid paraffin 200 gram. Melt the emulsifying wax and whites of paraffin. Add the liquid paraffin. Stir until it attains room temperature. Then compound benzoic acid ointment BPC, it is also called as a Whitefield's ointment, contains benzoic acid in fine powder 60 gram, salicylic acid in fine powder 30 gram, emulsifying ointment 910 gram. Triturate the benzoic acid and the salicylic acid with a portion of emulsifying ointment until smooth ointment is made. Gradually incorporate. Then creams. Creams are homogeneous semi-solid preparations consisting of opaque emulsion systems. Cream is divided into two types, namely as aqueous creams and oily creams. In case of aqueous creams, the emulsions are O by W type and it is relatively non-greasy. In case of oily creams, W by O type and it is relatively greasy. The cream should be stored in collapsible tube and supplied in well-closed container to prevent evaporation and contamination. Pests. Pests are homogeneous, semi-solid preparations containing high concentrations of insoluble powdered substances, usually not less than 20%, dispersed in suitable base. In diagram, pests is shown. They are mainly used as antiseptic, protective, soothing dressings. Pests should be stored and supplied in containers made of materials which do not allow absorption of diffusion of content. In gel. Gels are usually transparent or translucent, non-greasy, semi-solid preparations. Gels are applied to the skin of certain mucous membranes for protective, therapeutic, or prophylactic purposes. In figure, gel is shown. These are also used for lubricating catheters, surgical gloves, and rectal thermometer. Then, next point, new drug delivery system or novel drug delivery system. New drug delivery system is a novel drug delivery system, that is NDDS, which can be divided into two parts. Sustained release drug delivery system. It is a novel drug delivery system in which rate and extent of drug delivery is maintained for a prolonged period of time with the help of excipients or polymers. Controlled release drug delivery system. It is a novel drug delivery system in which rate and extent of drug delivery is maintained for a prolonged period of time but in controlled manner. New drug delivery system. With the advancement of pharmaceutical sciences, a new concept have evolved, various modern dosage forms and methods of their administration. Some of the modern dosage forms are implants, films and strips, liposome drug carriers, controlled drug delivery modules, erythrocytes, nanoparticles, and prodrugs. Firstly, implant. These are hypodermic tablets are placed under the skin by a minor surgery in order to release drugs over a prolonged period of time. Nowadays, the magnetically controlled implants have been developed. These implants are useful in hormone therapy. Then films and strips. These are meant for topical application for slow release of drug over a predetermined period of time. Films and strips are more popular these days. They are subcategorized into following types, namely as zero order release films, buccal strips, spray bandages, and liposome drug carriers. Liposomes are defined as the nano-sized vesicular structures consisting of an aqueous core surrounded with phospholipid layers. This can transport both hydrophilic and hydrophobic drugs. So in figure, liposome drug carrier, it is shown outer core, that is hydrophilic head, then aqueous solution between, and hydrophobic top. Controlled drug delivery modules. These are the devices which are formed by embedding the drug with a polymeric matrix so that it gets released slowly to the body over a long period of time. It will form drug polymer complex and may be formulated into tablet, capsule, or any other suitable formulation. The drugs is released from these modules by diffusion, osmosis, or chemical reactions. These are applied to skin, implanted subcutaneously, or inserted into various body cavities. In diagram, it is shown a drug and polymer and how it is released. Then erythrocytes. Erythrocytes are tried in order to achieve controlled release of drugs. It can allow a drug to circulate in the body for a long period of time, which help slow release of the drugs into serum. Released erythrocytes are prepared by putting them into a hypotonic medium so that they can easily swollen. The aqueous solution of the drug is added to the medium so that drugs get into erythrocytes through open pores. When isotonicity is adjusted, the erythrocytes shrink, thus encapsulating the drug within them. These erythrocytes may be suspended in normal saline solutions for preparing injections. In diagram erythrocytes they are shown. Lastly, thank you.